Hey Alpha Nurses, I'm Nurse Sandro from alphanurseguide.com. This is NCLEX PN review lesson 30. We're going to be doing blood transfusion questions. As always, you guys can follow me on Facebook, Instagram, and TikTok to get any updates. Links will be in the description. Without the way, let's get started.
Question 1. A client who is receiving a blood transfusion rings the call bell for the nurse. When entering the room, the nurse notes that the client is flushed, dyspneic, and complaining of generalized itching. How should the nurse correctly interpret these findings? A. Bacteremia. B. Fluid overload. C. Hypovolemic shock. D. Transfusion reaction. The correct answer is D. Transfusion reaction. Rationale: the signs and symptoms exhibited by the client are consistent with a transfusion reaction. With bacteremia, the client would have a fever, which is not part of the clinical picture presented. With fluid overload, the client would have crackles in addition to dyspnea. There is no correlation between the signs mentioned in the question and hypovolemic shock. The signs identified in the question are indicative of an allergic reaction, which is one type of blood transfusion reaction. Question 2. A client who was receiving a blood transfusion has experienced a transfusion reaction. The nurse sends the blood bag that was used for the client to which area? A. The pharmacy. B. The laboratory. C. The blood bank. D. The risk management department. The correct answer is C. The blood bank. Rationale: the nurse prepares to return the blood transfusion bag containing any remaining blood to the blood bank. This allows the blood bank to complete any follow-up testing procedures that are needed after a transfusion reaction has been documented. Question 3. The nurse is assisting with caring for a client who will receive a unit of blood. Just before the infusion, it is most important for the nurse to check which item. A. Vital signs. B. Skin color. C. Oxygen saturation. D. Latest hematocrit level. The correct answer is A. Vital signs. Rationale: a change in the vital signs may indicate that a transfusion reaction is occurring. The nurse assesses the client's vital signs before the procedure to obtain a baseline every 15 minutes for the first half hour after beginning the transfusion, and every half hour thereafter. Skin color, oxygen saturation, and most recent hematocrit may be checked but are not the most important. Question 4. A client is going to be transfused with a unit of packed red blood cells. The nurse understands that it is necessary to remain with the client for what time period after the transfusion is started? A. 5 minutes. B. 15 minutes. C. 30 minutes. D. 45 minutes. The correct answer is B. 15 minutes. Rationale: the nurse must remain with the client for the first 15 minutes of a transfusion, which is the most likely time that a transfusion reaction will occur. This enables the nurse to detect a reaction and intervene quickly. The nurse engages in safe nursing practice by obtaining coverage for the other clients during this time. 5 minutes is too short of a time period, while 30 minutes and 45 minutes are too long of a time period. Question 5. The nurse takes a client's temperature before giving a blood transfusion. The temperature is 100 degrees Fahrenheit orally. What should the nurse do next? A. The transfusion will begin as prescribed. B. Hold the blood and notify the healthcare provider. C. The transfusion will begin after the administration of an antihistamine. D. The transfusion will begin after the administration of 650 milligrams of acetaminophen. The correct answer is B. Hold the blood and notify the healthcare provider. Rationale: if the client has a temperature of 100 degrees Fahrenheit or more, the unit of blood should be held until the healthcare provider is notified and has the opportunity to give further prescriptions. Question 6. The nurse is assisting with caring for a client who is receiving a unit of packed red blood cells. The nurse should tell the client that it is most important to report which sign immediately. A. Sore throat or earache. B. Chills, itching, or rash. C. Unusual sleepiness or fatigue. D. Mild discomfort at the catheter site. The correct answer is B. Chills, itching, or rash. Rationale: the client is told to report chills, itching, or rash immediately because these could be signs of a possible transfusion reaction. Mild discomfort at the catheter site may be indicative of a problem, or it could result from the size of the IV catheter required to infuse the blood product. Sore throat, earache, sleepiness, and fatigue are unrelated to a transfusion reaction. Question 7. The nurse is assisting with caring for a client who has received a transfusion of platelets. The nurse determines that the client is benefiting most from this therapy if the client exhibits which finding? A. An increased hematocrit level. B. An increased hemoglobin level. C. A decline of the temperature to normal. D. A decrease in oozing from puncture sites and gums. The correct answer is D. A decrease in oozing from puncture sites and gums. Rationale: platelets are necessary for proper blood clotting. The client with insufficient platelets may exhibit frank bleeding, or the oozing of blood from puncture sites, wounds, and mucous membranes. The client's temperature would decline to normal after the infusion of granulocytes if those transfused cells were then instrumental in fighting infection in the body. Increased hemoglobin and hematocrit levels would be seen when the client has received a transfusion of red blood cells. Question 8. The healthcare provider prescribes 1 unit of packed red blood cells to infuse over 4 hours. 1 unit of blood contains 250 milliliters, and the drop factor is 10 drops per 1 milliliters. How many drops per minute should the nurse infuse? A. 8 drops per minute. B. 10 drops per minute. C. 12 drops per minute. D. 14 drops per minute. The correct answer is B. 10 drops per minute. Rationale: the prescribed 250 milliliter is to be infused over 4 hours. Follow the formula and multiply 250 milliliter by 10. Then divide the result by 240 minutes. The infusion is to run at 10.4 or 10 drops per minute.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.